Welcome, everyone. Really great to have so many of you here today. We are going to take stock today of where we are around the situation for LGBTIQ people around the world in the midst of the pandemic, 16 months in. And we have some really amazing speakers lined up today who are going to shed light on where we are currently. So for those of you who don't know me, my name is Maria Shedin. I'm Deputy Executive Director for Outright Action International. I use they, she pronouns. If you don't know Outright as an organization, we work at the global, regional, and national levels to eradicate the persecution, inequality, and violence that LGBTIQ people face around the world. We're a 31-year-old organization headquartered in New York City, but with staff and offices around the world in 8 countries in several regions of the world. We are, one of the things that makes Outright unique is that we're recognized by the United Nations and have a special, it's called consultative status. And it's one of the focus areas that we have for our advocacy. We're a feminist organization and bring a lens of intersectionality to our work, amplifying and supporting the voices and leadership of the most marginalized groups of our community. We have over 350 people signed up today for this webinar, and we couldn't be more pleased to have so many people join us. It's really quite amazing. And I see some people have started introducing themselves in the chat. Please go ahead and do so. It's really nice to know who's joining and where you're from. So thank you so much. We will be posting some resources and information in the chat throughout the session. It's a webinar style. We're recording it, and afterwards we'll share the recording with you. And let me say a little bit about who's going to join us here today. So we have my colleague Yvonne Wamari, based in Kenya. She's Outright's Africa Program Officer. We have Liberty Matisse from South Africa, the Executive Director of Gender Dynamics. And we have Ryan Korbari with the Crisis Response Mechanism at Ars Belangi in Indonesia. And finally, we also have Alex Gray, Director of International Funds at the Center for Disaster Philanthropy in the US. We're really grateful to all of them for joining today. And so just a little sort of historical by now view. When the pandemic broke out, Outright knew that marginalized groups were going to face challenges in a way that maybe others wouldn't, because that is typical for crisis situations, be it natural disasters, pandemics, or many other situations. So what we did was we launched a research project to document in real time what was happening to our communities around the world. And we found that there were people faced food insecurity, loss of shelter, people were forced to sometimes leave their homes. They couldn't pay the rent, for example, and had to go back to original families, in some cases, even though they had been rejected. So there were very many challenges that people faced. And so we realized that in order to respond to this, we needed to launch a fund so that we could fundraise and provide support for organizations and communities around the world. And I have to say the result was way beyond what we expected. At the end of 2020, we had distributed $1 million to 125 groups around the world. And we thought that was really it was way beyond what we had expected. as it turns out, by the end of this month, we will have distributed $3.2 million to over 300 groups in over 100 countries. And this is, I mean, it makes this fund the largest emergency COVID fund for LGBTIQ issues globally, but it really also means that we have reached and we have the ability through all our grantees to reach so many people. We estimate that the reach through these grants is over 140,000 LGBTIQ community members around the world. So that's today what we're gonna hear a little bit about. I want to just also pause for a second and say thank you to all of those who have supported the fund, and there are very many. So I'm not going to name everyone, because then that would take up the entire time. But some of those who have generously supported the fund include Google.org, Microsoft, the Dunn Family Charitable Foundation, Start Small, 2K, governments of Germany and Canada, Channel Foundation, Dry Linden, Herman Miller, Horizons Foundation, Oak Foundation, Open Society Foundations, Procter & Gamble, Scotiabank, Wellspring Philanthropic Fund, and of course, Center for Disaster Philanthropy that we're going to hear from today. So thank you to all of those that I named and to everyone else who has supported the fund. It's now my immense pleasure to introduce my colleague and Outright's Africa Program Officer, Yvonne. Please, Yvonne.
Hi everyone. Thank you so much, Maria. So I'm just going to provide you with a little bit more information about the COVID Emergency Fund and the impact that the fund has had on LGBTIQ lives globally. So Maria spoke about the report that we did that really just shared or showed us the impact that COVID-19 was having on the LGBTIQ community. And even as we began reaching out to activists and partners during that time in 2020, it was clear that many queer people globally who were already living actually in the razor's edge of poverty, were being pushed further into crisis by this pandemic. And they really didn't have, or they had very little support that was available to them to respond to the challenges that they were facing. So on April, 8th of April in 2020, we launched the Emergency Fund to provide assistance to grassroots LGBTIQ organizations around the world, really. And we did this mainly because, mainly so that we could see, because we could see the huge need by the LGBTIQ community, by the queer community, by the trans community. And these were people who were either not reached by the traditional or government relief efforts, or were excluded from these efforts. So our fund distributed grants to LGBTIQ organizations who were at the front lines of responding to this pandemic. In 2020, we received a little over 1,500 applications with 1,488 qualified applications from 141 countries, totaling 15 million in funding requests. The highest numbers of these applications were from sub-Saharan Africa with 730 applications, Latin America, then Asia, and then Eastern Europe and Central Asia, the Caribbean, then the Middle East, North Africa, and the Pacific. And these applications were from 131 countries. And by the end of 2020, as Maria has already mentioned, Outright had distributed in 3 rounds of grants, amount totaling to $1 million US dollars. And we had funded 127 groups in 65 countries and had managed to reach about a little over 50,000 LGBTIQ people. In 2021, organizations continued to reach out to Outright requesting for support. And that, combined with the information that we were receiving from our partners on the ground, it was clear that the LGBTIQ community was still affected by the pandemic And there was no doubt that we would have to open up another call for proposals to support the LGBTIQ community globally. So the new call was launched on 28th of February, 2021, in 7 languages. And this time we used a new grant management system called Fondant. The call for proposals was closed on the 16th. And in that period of time, we received 1,506 applications from 115 countries. Again, most of the applications came from Sub-Saharan Africa, then followed by Latin America and Asia. These requests totaled $18 million US. By the end of August 2021, and that's like to date, let me say, Outright has distributed $3.2 million US in grants to 310 groups in more than 102 countries. And we have reached 145,000 people with the support that we have offered. And we expect that we'll continue to process grants well into the end of the calendar year. So the grants that we received this year and the requests within the grants that we received in 2021 really didn't differ from the requests that we received in 2020. Most of the applications requested support for food assistance, shelter, healthcare, and those are the 3 major requests that we have seen that we received in 2020 and we've received again in 2021. The difference is that the number of requests that we received in 2020, a large number of them were from LBQ and trans groups. And this time, most of the applications were from rural and non-capital based organizations, while in 2020, most of the applications that we received were focused generally on the LGBTIQ community. So the general understanding from the applications that we received and the reports that also we've received from our grantees and partners on the ground mirrors the findings in 2020 that we received in our reports and that we received from the applications in 2020. So many queer people globally who were already again on the razor's edge are still suffering the impact of COVID-19 16 months in. The loss of jobs and income that devastated their livelihoods and food security, this still persists. And our movement, which is young, and many grassroots LGBT organizations, which are just setting up and are just trying to find their footing and really don't have that sustainability, are anxious about their survival and how does this ultimately affect their beneficiaries. So these are still some of the challenges that are being faced on the ground. And it is clear that in 2021, the impact of COVID is still being felt by the LGBTIQ community, and it will take a long time for them to recover. And until then, they continue to need our support in various ways, be it financial resources, be it technical support, be it our advocacy interventions. Our support is still required. So today, we have with us 2 of our grantees, and they will shed more light onto the numbers that I have given you. And they'll briefly share with us more about how COVID is affecting the communities in South Africa and in Indonesia, and how they have managed to support their constituents through the COVID Fund. They'll also share with us the ongoing needs and issues that are prevailing during this time. So I will introduce Liberty from Gender Dynamics in South Africa. So Liberty, kindly unmute yourself and go ahead. Welcome.
Thank you so much, Yvonne, and hello to everybody joining us online for this particular reflective space around the impact that COVID-19 has had on our communities. I think for me, I would want to start off by just trying to locate trans and gender diverse persons within the broader context within South Africa, and also to note that a lot of our COVID-19 efforts were not only pegged at the South African level, but also broader at a regional Southern African level. At the moment, about 8.8% of the South African population has been fully vaccinated, and that is in comparison to a global average of 25%. When a survey was conducted into July of this year to get a sense as to people's propensity to get vaccinated, 54% of the population indicated that they were vaccine hesitant, which also begs the question that even if we were to procure the necessary amount of vaccinations to vaccinate everyone, will we even be able to build a population immunity medium to long term? For this month, for this quarter, the unemployment rates and statistics came out, and currently South Africa's expanded unemployment rate is sitting at about 45%, which means that almost one half of the workforce that ought to be working is currently unemployed. And that, of course, has repercussions for trans and gender diverse persons and queer communities whom we know bear a disproportionate burden within that particular finding. When we look at the challenges that our community members have experienced, then we know that these are not new challenges, that a lot of the challenges pre-existed COVID-19, whereby COVID-19 nearly exacerbated those very challenges for our communities. And so the issues that we've seen emerge is issues around unemployment, which I've spoken to now, but also the consequences that flow from it, which has been homelessness for one. Many trans and gender diverse persons coming out to their families during lockdown have found themselves being kicked out of their homes by loved ones, and of course becoming street-based. We also know that in the country we have a problem with the shelter system, whereby at policy level there might be commitment to including trans and gender diverse persons in a very gender binary orientated shelter system, but at implementation level when our people go to shelters, they are often turned away on the basis of the gender identity and gender expression. And so these arbitrary measures put in place puts our people at risk of violence when people are not able to find that level of stability. We've noted that food insecurity remains a big issue as a result of unemployment, and that of course many people carry a lot of mental trauma, both historical and current, that has led people to feel depressed, heightened feelings of anxiety, and also suicidal ideation that necessitated a mental wellness response from this particular program that we are driving. From a physical wellness perspective, we know that there has been hormonal insecurity whereby people couldn't get access to hormones during this time because of the suspension of services, not just in South Africa, but also more so across the Southern African region. We know that trans women in particular carries a disproportionate HIV burden, and some studies that has been conducted within the South African context takes the HIV prevalence rate for transgender women at 63%, and noting that as an underlying health condition in lieu of COVID-19, that has raised our concerns as to the amount of people we might have lost, but whereby these particular deaths of trans and gender diverse persons were not reported because legal gender marker changes have not been made and forename changes have not been made. We've also seen a spike in gender-based violence during lockdown, where people have been locked in with violent family members, an increase in intimate partner violence, domestic violence, and of course, just after the relaxation of lockdown measures, we've seen a spike in hate crimes. Just between January and June of this year, we've seen 9 queer people being killed in South Africa. And we asked the question, even in a country with such a progressive legal framework on queer rights, why is hate crime such a big problem? And of course, again, speaking to that theme, a crisis within a crisis. I've spoken a little bit to the hormonal insecurity. We know that The suspension of gender affirming surgeries also caused the waiting list to now increase from 25 years plus to between 30 to 40 years for trans person to get access to that level of care in the public healthcare system. And that is according to estimations by some clinicians. And then of course, we know that because there's this intimate tie between the healthcare system and of course the legal system in getting legal gender recognition, that because you can't get access to gender affirming healthcare, you will not get access to legal recognition. Some of the additional challenges that we've experienced is again the lack of data and research on our communities. And even at the heart of the COVID-19 pandemic, we don't even know how COVID-19 has impacted our communities because of the lack of data that's being gathered by the state and by health institutions for people who want to voluntarily disclose their gender identity within this particular context. There's been an increased need by trans and gender diverse-led organizations for resource security. The COVID-19 fallout, unfortunately, has also caused the redirection of certain funds away from nascent emerging organizations towards frontline emergency responses. And of course, that now means that the existence and sustainability of community-led organizations like the trans and gender diverse community-led organizations hangs in the balance, which have repercussions for the trans movement and how we can advance for change in the region. And at the same time, it provides greater space for movements such as the anti-gender ideology movement to take up space within the region. So we are calling on increased funding to be directed towards resourcing this level of work within the region for us to advance an inclusive agenda. So in lieu of all of that, I think that the resources allocated by Outright Action has been critical in being able to fill some of these gaps that I've spoken to now. And we've been able to implement a COVID-19 regional response project since June of last year up until now, and it will continue up until the end of the year, that addresses the issues of food insecurity, personal access to personal protective equipment, administrative support to organizations that might be struggling operationally, mental wellness support to community members, leadership support to trans and gender diverse leaders who we know are carrying a lot at this time, and data vouchers to be able to breach the digital divide within this particular region. And that we've been able to implement also with 23 trans-led, trans-specific and trans-inclusive partners across the region, and of course across 10 countries in Southern Africa. So in conclusion, I think that the resounding feel at this time is that COVID-19 and the consequences that it has in store for us will be long lasting, and particularly the socioeconomic consequences. And that should not be, we should not be distracted by the fact that people might get access to vaccines, because ultimately the high level of unemployment that we are faced with at the moment showcases what the dire future for most people, including trans and gender diverse people, look like within the Southern African context. And for that reason, we would want to stress the importance of continuing to resource this level of work, because it is life-saving and it is life-changing.
Thank you so much, Liberty. Thank you so much. Ryan, I will move over to you, and maybe you could share with us the Indonesian perspective of how COVID is affecting communities and what you have managed to accomplish through the COVID fund from Outright. Thank you. Welcome, Ryan, and please try and keep it within the allocated time. Thank you.
Thank you so much, Yvonne. Good afternoon and good evening from Indonesia. It's almost midnight here, so mind my lighting and my blurry eyes because I have to wake up. And yeah, my name is Ryan Korbari. I am the chairperson of Indonesian LGBT Federations, Arus Pelangi, and I'm now representing Crisis Response Mechanism Consortium. Crisis Response Mechanism Consortium is a national consortium which established in July 2008. CRM has focused to resource mobilizations for crisis prevention and crisis response. CRM has a 5 members organizations, Arus Pelangi, GWL INA, Sanggar Suara, Legal Aid Institutions, and then UNAIDS Indonesia. Now the situation in Indonesia, it's we began a second wave of the COVID-19. It's happened now. The COVID-19 patient number increases dramatically. Social restriction happen again, so people know all in home, and then it seems like going back to the 2020, but it's worse now because every day we hear a news, a reports that someone passed away, and it's so many pass away cases in Indonesia. So yeah, that's really horrifying, but fortunately we survived. The conditions is defined by this condition is defined by CRM consortium as a multi-dimensional crisis. Based on the result of the CRM research in 2021, it shows that COVID-19 against LGBT affect at least 3 aspects: economic, legal, and social. In the economic aspect, it shows that 97.6% of LGBT experience a decrease the income caused by layoff, large-scale social restrictions, close their public businesses, and others. In legal aspect, the policies of the large-scale social restriction, we call it PSBB or PPKM, is changing everything, our government. Emergency public activity are not in line with the government commitment to ensuring social support and assistance for LGBTIQ. This is in line with the research that shows that 50.3% of LGBTIQ not receiving assistance from the government because the several reasons, such as they don't have an ID card. Also, LGBT is not prioritizing in the government program. Lot of lack of access for the informations and discriminations based on their suggestion. In the social aspect, 36.6% of LGBTIQ people experience physical and psychological violence during the COVID-19 pandemic. At least since last year, CRM has been receiving 49 cases of violence against LGBT people in Indonesia that has various cases, start from persecutions, arbitrary arrests, expulsions, until murder. In terms of the vaccination, the vaccination number in Indonesia is still low. From the survey that conducted by CRM recently, 40% of the respondents didn't get the access and the information about the vaccine. So most of them didn't get the vaccines at all. That's worsened the situation since the social restrictions is everywhere in Indonesia. From the situation above, LGBTIQ community must be survived through the collective effort. That's why we encourage in Indonesia that because the government can help us, so we have to help ourselves. So we have to make a collective effort. Instead of the funding that we get from the outright, crisis response mechanism also consortium has been collecting public donation since March 2020 that distributed to 3,543 LGBT in 20 provinces in Indonesia. The needs is changing, but we are trying so hard to provide that. The donations that we given to the community is a cost of basic needs, food, rent, boarding house or house, and then the cost of medicines and help for self-quarantine, and the COVID-19 test, and the transportation cost for the access for the IRV for the people living with HIV, medical kits, masks, face shield, and etc. And then lastly, what we can do as the community, and then global solidarity. LGBTI community as a vulnerable group get double discriminations. They lack an access to the everything in terms of support during this pandemic. So it's important to tell your networks that you have to prioritize LGBT people in a various support. So if the government can do that for you, you have to building and organize support and allyships to support the marginalized and vulnerable group. And one of them is LGBTIQ person. And also raising public donations is also important because, like I said before, that if the government can help you, you have to help yourself and building a solidarity to raising a public donations. And in terms of the funding, I think the reserve fund is also necessary because the needs are changing time by times, and then we cannot put on the tables what they need. So the reserve funds that we can do for the contingency actions in terms of the pandemic situations is necessary. So I think that's all from me. Thank you so much. Looking forward for the questions. Thank you.
Thank you so much. Thank you so much, Ryan.
It's okay, go ahead.
Ryan, if you have a link to the research that you have from the crisis response mechanism, please feel free to put it in the chat, or maybe we can connect about it afterwards, because I think there are many people who are interested in being able to see it. And
yes, I can. We also launch a cartoon videos about that, but it's in Bahasa Indonesia. But I can share you in the chat box.
All of us will happily practice our Bahasa Indonesia for the opportunity to see it.
Okay, I will.
Thank you so much. Okay, we're gonna move on to our final panelist, Alex Gray with the Center for Disaster Philanthropy. And you are a partner and the funder to Outright's COVID Emergency Fund. Tell us a little bit about what you see and why you chose to partner.
Sure, thank you, Maria. First, I just want to say I'm so excited to be participating in this panel with you all today. Thanks to Outright International for inviting me, and also to my fellow co-panelists for sharing the space with me. The level of discussion so far is off the charts, and I'm really impressed. I'm going to start maybe just by a quick introduction as to who's CDP, or the Center for Disaster Philanthropy, who we are. Our vision is a world where the impact of disasters is minimized by thoughtful, equitable, and responsible recovery for all. I've put a quote here from a blog which we have created on intersectionality, which we can post the link in the chat. But that quote says, disaster funding from philanthropy and government needs to be based on equity and justice to truly help all people rebuild. The Center for Disaster Philanthropy was created around 11 years ago with the kind of main purpose of trying to ensure more informed disaster giving, recognizing that there were certain best practices that weren't being adhered to. So we have three pillars. We educate and inform the philanthropic and donor community about how to do better, more informed, equitable disaster giving. We also provide some consulting services to the philanthropic community to do the same. And then finally, and I guess the relevant one for this call as well is, we do grant making and manage a number of recovery funds, and we manage a COVID recovery fund. I will just stop sharing my screen so you can see me. Great, excellent. As we've kind of heard from the other panelists, people are not equally affected by disasters and crises such as COVID, nor do they recover equally. unless there's a concerted effort from donors and other actors to identify the specific needs of vulnerable and historically marginalized populations, and then to fund programs that specifically address those particular needs. And I recently penned a blog on this issue, and we'll put the link into the chat as well. I won't go over all the statistics. I think that we've heard from South Africa and Indonesia, and Yvonne as well, about just some of the statistics that we're seeing around COVID. So I'll try to kind of keep my discussion around, what we can do as funders and why we're funding Outright International's COVID fund. I mean, the first thing to say is I think that, most donors nowadays have some policy stating that they support LGBTIQ equality and that they won't fund anti-LGBTIQ programs or organizations. And we also have humanitarian standards that require us to specifically consider vulnerable groups such as the LGBTIQ community in needs assessments and in program design. However, this rarely happens in practice, at least in my many years of experience working in the field. Some of that is because of gaps in organization systems. Some of that is due to the local context and culture. And some of that is simply due to staff capacity and attitudes. Even the most well-intentioned donors and civil society organizations with good policies aren't seeing them implemented in practice. And I mean, a really interesting piece of research that was done recently, well, it was a recent investigation published by Open Democracy, found that many organizations in Kenya, Uganda, and Tanzania were found to be pushing anti-gay messaging, including harmful gay conversion therapy, while receiving funding from international donors that support LGBTIQ equality. Donors such as USAID, World Bank, MSI, etc. And at CDP, we want to change that. And that's kind of part of our educate and inform pillar. As part of that pillar, we produce products called Issue Insights. And in our Issue Insight on how LGBTIQ populations are affected disproportionately by disasters, we are very explicit in our recommendations to funders. And I just want to highlight a few here of the most important ones in the interest of time. The first and the most important one is, the donors should fund LGBTIQ organizations when providing humanitarian and emergency response and recovery funds after a crisis. LGBTIQ organizations are not always the most visible disaster responders, but those that they serve are very vulnerable, and these needs constrain the capacities of LGBTIQ serving organizations. So we feel it's important to invest in the organizations themselves. The second recommendation is that for funders is, talk about the issues with your grantees and with other funders. We convene groups and we do talk to other funders about this, and we stimulate discussion on these issues. We ask other funders about LGBTIQ organizations that they're supporting. And we also suggest that you ask your grantees how they are doing explicit outreach to LGBTIQ communities. Another recommendation that we have made and you'll see that in our Issue Insight, is to ensure that all of your forms are LGBTIQ inclusive. If you ask for gender on a form, for example, ensure that you provide several options for gender, including an other option as well. And then the last kind of recommendation I would highlight is, to track LGBTIQ populations served within your grants that you make to disaster response and recovery organizations. Many funders ask grantees to track a variety of populations served by their grants, such as children, women, people of color, older adults, disabled populations. And similarly, you can ask your grantees to track the number of LGBTIQ people they serve with your grants. And that's something that Center for Disaster Philanthropy does. I also want to talk about tackling the root causes of injustice in disaster preparedness, response, and recovery. the majority of funders rarely look at, why these populations are being disproportionately affected in the first place. But as you dig deep into these answers, you'll soon find that at its core, it is inequity and injustice, and not nearly enough funders and grant makers support efforts to address these root causes. At CDP, our focus on equity, recovery, and resilience is what led us to invest in Outright's COVID Fund. It was really a very easy decision for us. In addition to being a wonderful organization doing incredibly important work, the fund is funding COVID relief programs for LGBTIQ populations who have been disproportionately affected by the pandemic and who are often left out of relief efforts, which we've established in this panel is very important given the current state of play on the ground in many contexts. But one additional reason, and a very important one for us, given our commitment to addressing the root causes, is that the COVID Fund by Outright International is investing in grassroots rights organizations, often LGBTIQ-led organizations, as well as the movement in general. And we at CDP believe that this helps amplify the voices of LGBTIQ leaders, but that this will also help build resilience, allow for some of those structural inequities to be worked on, and hopefully maintain and improve the capacity of these organizations to respond to future disasters which will affect the LGBTIQ community. At CDP, we want other funders to follow our lead in ensuring equitable recovery for all. And indeed, that's a key role of CDP within the broader ecosystem. And we can do that in a variety of ways through exemplary grant making, through storytelling, communicating our impact, and by convening, educating, and informing the philanthropic community as well as other donors and actors. And I'll just end by saying that, while there's still a very long way to go and there are horrifying circumstances for LGBTIQ people around the world right now, both related to COVID and, outside of that, we are also seeing a lot of progress whereby LGBTIQ issues are being tackled and addressed by mainstream organizations as well. From my own personal perspective, whereas 10 years ago, some of my ex-employers like, Save the Children and Plan International and others, they were not speaking up about issues facing LGBTIQ children and youth. And yet, today we're seeing that they're very vocal on these issues and showing real leadership in this space. So in addition to funding LGBTIQ specific organizations, which is fantastic and a great effort, and we support it, it's really heartening to see progress like this in the mainstream disaster response agencies as well. And it makes me hopeful for the journey ahead. And hope is something we need with everything that's going on in the world right now. Thank you for letting me share with you today, and I look forward to the question and answers.
Thank you so much, Alex, for joining us today and for your partnership with Outright. I want to say, before we jump to the Q&A, I just want to say a couple of things about what we at Outright have learned throughout this more than a year. We already knew that humanitarian responses too often exclude LGBTIQ people, and we've heard many examples of that today. Where we're taking it in the next steps is to launch a project on queering humanitarianism. We know that with the data that we have accumulated through our research and also all the rich data that comes through our grantees, we know we can have an impact on the humanitarian aid organizations and the governments that fund them, because we know this is not going to be the last disaster, the last humanitarian catastrophe. And we need these large institutions to get better and to be more inclusive. So that is a commitment from Outright that we're going to take on that advocacy. We have, of course, I mean, some of the issues that we hear about here, of course, are about the inequalities of the world as well. I mean, that comes back when we see the inequality of vaccine distribution. where the global south, where the majority of the world's population live, and also where you see, for just as one example of oppression of LGBTIQ people, the criminalizing laws that criminalize same-sex relations. I mean, the combination of this and the lack of access to vaccines in large parts of global south really show us that for the time being and for times to come, the majority of LGBTIQ people in the world continue to exist in a crisis within a crisis. But I also have to say that another lesson that we've learned is that our friends and our allies are truly generous. And we had no idea that we would be able to raise so much funds and distribute so much funds. And it goes back to what Ryan also said about how we step up for each other and we look out for our own communities. And I think that's an incredibly important lesson. And both Liberty and Ryan spoke to how they are supporting their communities to survive and thrive. If you're thinking about what you can do, of course, you can continue to support the fund. We will continue to distribute grants as long as we have funds coming in that allow us to do it. Please, speak up and ask mainstream relief organizations, funders, and governments what they're doing to ensure our inclusion and help advocate for an urgently expanded and equitable vaccine access around the globe that explicitly includes LGBTIQ people. And of course, please stay involved with Outright, not just in a time of crisis, but on an ongoing basis. We're going to go to some of the questions. So you can post your questions in the Q&A box that you find on your screen, and you may also have posted something in the chat. Let me say quickly, I see there are some questions about, can you still apply for grants? And if you applied and you didn't hear yet, what does that mean? So for the moment, we don't have any open calls for proposals because we've received, as you heard, so many proposals and we don't have funding to support all of them. If it changes down the line, we will definitely let people know and post it on our website and circulate it. I think actually almost everyone who has applied should have heard by now. And so, if someone hasn't heard, please let us know and we'll find out the status. But most everyone should have heard. And someone is asking, is it possible to fund the program for senior citizens? I want to say that we have funded many projects directed at subsets and different groups within the LGBTIQ communities. So we have definitely included various projects, including for senior citizens. Let's see. Donors are increasingly building in emergency grant mechanisms in their programs. Is this good, or is it better to have a more central funding mechanism? Liberty or Ryan, do either of you want to give your opinion about that?
I think perhaps I can take a jab at it, Maria. I think for us, the issue around, that's good, the fact that donors are recognizing that different contexts requires different responses, and some of those responses would include being able to meet the needs of the material needs of communities as they emerge. We often find ourselves within crisis situations because of the environment, transphobic, queerphobic environments that we exist in. The only question that I think organizations like Gender Dynamics has around that level of support is continuity and sustainability. And of course, when you start intervening on an emergency basis, every single person that we engage with as an organization presents a case of an emergency, but at the same time, we also know that it ties into a longer response that we would need to put in place. And so we ask ourselves, do we only tend to this one emergency because tomorrow the person is still going to be homeless, the person is still going to be food insecure, and the government is still not necessarily going to provide that level of support. And so if we are working with this person, to what extent do we then work with the person and supporting that person, and at what point do we then cut off support without it coming across as being inhumane? And I think that is a conversation for us that we would like to also talk a bit more about, in terms of how do you manage that expectation with a community member, but also how do you shape your expectation in relation to donors, building that mechanism in, because sometimes it does feel like it's just a numbers game. So if in the emergency frontline responses, if donors can display that they have reached 100,000 people, oh, good for you, you are incredible, you are crying God within this particular era or area. But to what extent is there real interest to wanting to change the lived realities of people, which is going to be a longer term type of response as well? Don't know if that answers the question, but that is what my perspective.
Thank you.
I also agree
Ryan,
with
go ahead. Yeah.
Liberty. And then I also want to add that the needs may change, but the only one who knows the needs of the LGBT community is the LGBT organization. So what we do is we help each other, because we also the part of the community. We are also the part of the community who needs the support for the in terms of the pandemic situation. So yeah, it's good to be centralized by LGBT organizations.
Thank you so much, Ryan. And I mean, I know that's why the crisis response mechanism has been set up, so that you are closer to where the crisis actually happens. But of course, central mechanism, I really, just as the person who posed the question, it's like, it's not either or, we need both. We need a central place, or we need multiple central places where you can reach out when there is a crisis, but you also need a response that's more close to the ground, that might be able to act and find out things even faster. Let's see. Yeah, Liberty, do you want to take the question about, you know, how difficult it is to access trans-specific funding, and do you have any recommendations to trans-led organizations trying to survive and sustain themselves during the pandemic? Anything besides what you've already shared today?
I think it's been a bit of a conundrum in terms of the difficulties that we are faced with in terms of trying to source trans-specific funding. It's a conversation that we had just this afternoon. So we're looking at the trans movement and what we seek to accomplish within Southern Africa, and the fact that a lot of organizations, particularly nascent emerging organizations, are resource insecure at this point in time, which of course has a lot of, there's a lot of negative consequences that can flow from that. And so I think for us at the moment is really trying to collectivize ourselves under the Southern Africa Trans Forum umbrella, and being able to have a unified voice and say that resource our work in order to keep the momentum for positive gain possible. I think at the same time, what we've seen through emergency relief funding that has been funneled in drips and drabs at some points to different organizations across the region, is that in many instances, the funding itself is only focused on the resources allocated for the emergency relief, and that no resources are allocated for core support in order to sustain organizations. And the question we have asked is that, who will do the work if the people in the organizations are not there to drive the response? And so to a greater degree, when we're looking at balancing the issues, we need to be also equitable in what the expectation is to drive an emergency response. And of course, being able to look at how we resource organizations. A lot of the people in organizations are also community members, come from similar circumstances in the communities themselves. And so if we are not going to be tending to that, the emergency response in itself is compromised.
Thank you so much. I saw a question in the chat about need for mental health services around the implementation of funds. And I've seen, of course, mental health was one of the areas that we got a lot of funding requests for. But we've also seen in some of the projects that the people applying for funds and as they present their project plan, they have already included that to ensure that the people working in the project also has access to some mental health support. So I think that's one way that groups are grappling with that challenge, by ensuring that it's built in, because we all know a lot of this work is very, very hard. And so ensuring that the people who do the work have a chance to talk to someone is part of the way that we see some grantees structure their work. So there's a question about the vaccine equity. Is there anyone who want to comment on that? Anything you've heard about LGBTIQ people specifically being able to access vaccines? I have to say that sort of from Outright's point of view, we haven't heard that much yet. We've heard, and what we've seen in some of the proposals is that some groups have included that in their proposals and specifically highlighting the situation for trans people, depending on, of course, the societal discrimination and stigma, but also in relation to having so-called, the identification cards required and stuff like that. So we know that some of the groups are particularly looking at how they can help trans communities also get access to vaccines. And hopefully there will become more data available about that, because of course it's going to be it's going to continue and remain a challenge for the foreseeable future.
Maria, if I may add to that, looking at South Africa and the stats that a large part of the population has not been vaccinated. A recent study has shown that 54% of people are saying that they're hesitant to take the vaccine. And we suspect perhaps there are some LGBTQI people that's part of that 54%. And then we look at what's currently happening at sites in the country, and we are intending on submitting a letter to the Department of Health, which is that when you get to the front desk, you need to present your identification document. And many times that's the first point of conflict, as you mentioned now, in stigma and discrimination. But then there's also this other component where there's a 15-minute waiting period, where you're placed in a big venue with other people and being called out when your waiting period is over. And that's also another form of outing. And so we're also trying to establish to what extent will that act as a deterrent for trans and gender diverse persons to get access to the vaccine, because people might be fearful of being outed. And we know what happens when people are outed within violent contexts. We are subjected to sometimes brutal violence. And so that is something that we also want to explore a little bit more in our context.
Thank you so much. We're coming up. Please, Ryan, go ahead.
Okay. So in terms of the vaccines, what I mentioned before is Indonesia, if you want to have to access the vaccine, you have to have an ID card. It's become a problem for the transgender women who don't have an ID card. So yeah, most of the transgender women doesn't have an ID card because they are run away from home since very young, and then they don't have an proper education and ID card, so they cannot access the vaccines. That's what the problem in Indonesia. And it related to the transgender fund and solidarity. So it also happened in Indonesia that we are prioritizing transgender people to get the support. So in CRM, we are put a table of prioritizations that put the transgender on the top of the prioritizations, because of most of transgender women are sex workers, they're living under the poverty, and then so we prioritize them. So it's not because of this is a solidarity, it's not a job only for the transgender organization. It's also a responsibility for the LGBT organizations to help each other and prioritizing the most vulnerable group, in this case transgender people. Thank you.
Thank you so much, Ryan. And we're on the hour, so I want to extend a very heartfelt thank you to Liberty, Ryan, Yvonne and Alex, for joining us here today and sharing your experiences. And I hope everyone feels that the session was informative. I know there were questions we didn't get to. I apologize for that. If you are thinking about what you can do to help, help amplify the messages and learn more yourself. And of course, if you're in a position to do so, please donate. A little bit about what's ahead for Outright. We are always trying to raise the visibility for LGBTIQ people and our human rights globally. So we're launching a campaign this year, and we'll invite you to engage and amplify it. Out Summit, our annual conference, will be virtual again this year, December 8th to 10. And so there's 3 packed days and the ability to learn more and engage with others. So please stay tuned for that. Thank you so much, everyone, for your support and for joining us today. Thank you so much.